In this video, the Center for Teaching at the University of Veterinary Medicine Hannover will demonstrate the placement of a peripheral intravenous catheter on a dog. Only one of the correct methods to perform this skill will be shown here. Needed for this skills lab exercise are a pair of scissors, a water-resistant marker, tape or self-adhesive bandage, syringes, disinfectant, swabs, a peripheral intravenous catheter, abbreviated to PIVC, possibly a second replacement PIVC, gauze bandages, a heparinized saline solution, a tourniquet, a shear machine, and cellulose sheets. The intravenous injection is the fastest method for delivering medication into an organism when comparing different application methods. It is commonly used when applying anesthesia or in emergency cases, such as when treating an anaphylactic shock. Possible sites for injection are the vena cephalica antebrachii on the front limb of dogs and cats, as well as the vena zaphena lateralis on the hind limb of dogs and the vena zaphena medialis on the hind limb of cats. First, all required materials are placed within reach. A second PIVC should be prepared as a replacement. In a syringe, 1 ml of heparinized saline solution is drawn up. Next, 2 strips of tape are arranged as to allow an immediate fixation of the PIVC once it is placed. For this, the tapes must have enough length, allowing them to wrap twice fully around the limb. On each piece of tape, fold one end over itself and place an incision into the center of the fold. The tapes shown here are only utilized for practice purposes. Alternatively, there are other types of tape which can be used. A 4-layered strip of gauze bandage is prepared. 2 incisions are made, allowing for a placement over the distal plug and dorsal port of the PIVC. The materials are removed from their packaging. The protection cap and plug are removed and the PIVC is placed within reach. If the peripheral intravenous catheter is to be placed into the vena cephalica antebrachii, then the animal should be restrained in a sternal recumbency, standing, or sitting. The fur around the injection site is shorn. Cellulose sheets are placed under the limb which will be punctured. The tourniquet is placed distal of the elbow on the simulator. When placing a PIVC on a living animal, however, the tourniquet is placed proximal of the elbow. The best puncture spot is chosen as distal as possible. For this, the index finger strokes in a distal direction over the vein. The vein has bounce and feels full. The chosen puncture spot is disinfected using a swab and the prepared skin disinfectant. The limb is held, pulling the skin tight over the vein, without, however, compressing it. The vein can then be punctured in an acute angle of around 30 degrees. The bevel of the mandarin points away from the animal. Once blood appears in the catheter's hub, the mandarin can be retracted. Simultaneously, the catheter is advanced further into the vein. The hand fixating the limb can now also hold the catheter's wings with the thumb and index or middle finger. The mandarin is removed completely and disposed of in the appropriate container. The tourniquet can now be removed. The catheter plug is then screwed back onto the hub. Finally, the PIVC can be fixated with the prepared tape strips. The catheter is then rinsed with a heparinized saline solution. The PIVC can then be fixated with further strips of tape as well as wrapped in gauze bandage. The end of the gauze is then once again fixated with tape. For the removal of the PIVC, a swab and tape are prepared with the tape covering the swab. All pieces of tape and gauze over the PIVC are removed. The catheter is then pulled distally out of the vein. The swab with tape can then be placed onto the puncture spot and fixated. The PIVC is disposed of in the waste.